Order, meeting of the Board of Health on October 14th, 2020.
Alan Ginsberg, Art LaPole,
Present.
Corey Tello, Hannah Eisner, Judy Buchanan,
Present.
Richard Janetti,
Present.
Robert Colhase,
Present.
Scott Hume. Scott Hume,
And I just
I
joined.
see him, but
You do?
His mic is off.
Sonia Reese,
Here?
Schaefer,
Here.
And Hannah's joining.
and Hannah Eisner.
Scott's muted.
Scott Hume.
Hannah?
Can you tell what I am?
Yes. The coronavirus herself
So,
Yeah, I'm the COVID slayer.
in person. Guess what I was? I had,
I heard that, go ahead, Judy.
no, I'm done.
I was gonna say, I heard that a fly on your hair got a lot of media attention. So I'm just saying, if that worked, I thought this ought to work too. So guys from the media, just know, I'm there for you.
you want to take our picture now before we get going, Paul?
I'll wait till during the meeting. I want to see
Okay.
what they keep.
So,
I won't survive wearing these very much longer.
yeah, that's going to be the other problem. So just a correction to the agenda, we're not going to have a closed session at the end.
Okay.
Okay,
Yes.
so do I hear a motion to approve the minutes?
So moved.
Second.
Well, there's two of them. Second, the special session on August 18th and our regular session on September 8th.
Mm-hmm.
Right,
Sonia
Steve?
was yours to
Move
approve both.
approval.
We have a
Second.
second.
Yeah.
Roll.
Alan Ginsberg, Carla Pohl,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes,
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Still on silent.
Sonia Reese,
Here?
Susan Schaefer.
Yes. Is
All right,
Scott,
next-
I don't know if
Yes.
Scott can hear us or not.
Yeah. IT Scott are we connected with Scott Hume, Dr. Hume?
Mm. He may be on.
You're, Scott, can you hear us?
There he is.
Oh, there you are.
We can see you, but we can't hear you.
Can you do a sound
Can you hear me now?
Yes.
Yes.
Are they? Okay. Sounds good.
All All right, so our next agenda item is the consent agenda.
And that, the bills there are for August.
Okay,
I so move.
Second,
we have a motion on the floor for the consent agenda. It's been moved and seconded. Call the roll.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
yes.
Robert Colhase,
Yes.
Scott Hume,
Yes. Yes.
Sonia Reese. Sonia Reese. Sonia Reese. Susan Schaefer.
Yes. Sonia looks kind of frozen there.
There we go. Sonia, do you want to vote on that last motion? Okay. Behavioral Health Coordinating Council, Member Reese?
Get back in. Okay.
Have you guys met?
No, we meet tomorrow.
Oh, tomorrow,
Can you
okay.
hear me?
Mm-hmm.
Okay, we meet tomorrow. So stay tuned.
All right. Let us know as soon as you get the information on the mental health
Form.
forum. Thank you.
Yes.
Okay, Ms. Tello, Mental Health Advisory Board.
Yes, we actually had two meetings since our last board meeting. So on September 25th, there was a joint meeting of the Mental Health Advisory Board and the Policy and Funding Committee of the Health Department Board. And I'll try to sum it up. It was a lot covered. And so the goal of that meeting was to begin creating a marketing plan to promote the use of behavioral health services and to continue to emphasize reducing stigma to seek help. And we wanted to have particular attention to the communities that have been most impacted by COVID and by social injustice. So the idea was to work towards figuring out how we can create relationships so that we can encourage more connection to the social service agencies and even our own health department and services we offer. So we talked about activities and models that we could use to do that. We did some beginning of identifying impacted or underserved neighborhoods or communities or groups or organizations. And then we talked about identifying individuals within those areas or communities that could kind of become liaisons that could help us with messaging and marketing. Thinking that information and reducing stigma would be better, be more likely to happen if peers were the ones that were talking with them about that. So we examined some models. One was the National Alliance of Mental Illness, peer-to-peer support. One was the University of Colorado, which has a resiliency support model. And then Mental Health America has the peer coaching and self-directed care model. So we talked about that. And we identified some things we could do right away while we're developing kind of a bigger, broader, more robust community liaison support model. And we thought that we wanted to make sure that mental health first aid and youth mental health first aid are both widely available to have people in the community just know how to better help anyone they might know in their world, in their particular sphere that needs some supports or needs encouragement to seek help. So we basically agreed to form a work group. So that I'll talk about in a minute, because then our next meeting was the marketing work group But also on the September 25th joint meeting, we also talked about sustainability, because we had also talked about having some dollars set aside to help promote sustainability, meaning that any social service agencies or any organization that's offering services, we want to help them be better at being able to be self-sustaining, so that we can use our dollars, our 553 dollars can go farther. So helping agencies find ways to seek additional or alternative funding, which of course some of them do, but just how can we help them with that? And so we talked about collaboratively seeking grants. We talked about working with funders on blended funding, streamlining applications for funding. We talked about coming up with kind of a clearinghouse that would be a clearinghouse for grants, where one group or entity would kind of be that place where they seek out grants and can be tapped into for agencies to tap into to find out about grants. We talked about having experts and do trainings, experts on sustainability come and do trainings or webinars or whatever. So all those things. And then we also have a very small group, but basically Lori Woolrab from the Mental Health Advisory Board and the County Board is going to be working with Amy and Taylor, I believe, on further defining that sustainability plan. So, and then any questions on that before I talk about the marketing group? Or anybody else have anything they wanted to say about that? Okay, all right, then the marketing group met just on Monday, the 10th, and that group consists of some mental health advisory board members and some board members, and obviously Amy and Taylor and myself. And how we started with that is we were talking about wanting to market social services, but of course, we also know that some of our social service agencies are pretty much at capacity, particularly for Medicaid clients. So, and they have waiting lists. So we have to be mindful that we aren't marketing something that we can't deliver. So, we kind of, again, keep talking about what can we do right now versus what can we do to build a more robust response to this. And so at this point, one of the first things we're going to do is continue to promote the 211 campaign that United Way and some other agencies, I know Project Oz, I think Sally Gambacorta at Carl, I think Chestnut was involved with that. So we want to really keep promoting that 211, understanding that for anybody that is your best avenue into services. So we wanted to develop on existing work and just further expand that theme and build some timelines into that. So we're identifying campaign partners, and we're going to meet with some of those people that were already doing that and see how we can put that all together to build on disseminating information through a variety of mediums, organizations and locations. And again, particularly within those prioritized communities, we talked about putting flyers in food baskets. We talked about putting them in church bulletins. We talked about groups like faith-based groups, Parents of Children in Head Start, WIC, Boys and Girls Club, YWCA, Healthy Start, et cetera, advocacy groups, fire stations in rural communities, because of course we do not want to leave out our rural areas. We talked about barbers and hairdressers, who are at the hub of many parts of the community, senior citizens, those in subsidized housing. Those are all ones we want to make connections with. And we want to make sure we advertise the triage center. And then we want to develop a pilot for community liaisons. Those people I talked about earlier, the people that are actually living in certain of these neighborhoods or in those communities, and how we can get them to work with us to be our messengers and our marketers. And we talked about maybe starting slowly with 4 people, and then actually perhaps using the money that we had set aside for that, and perhaps work with giving them a stipend, but that stipend would be based on performance objectives that they meet, so that we make sure that they really are doing some deliverables to those communities we identify. And then we talked about how we want to make sure we support and sustain and train them. So that would be providing them with mental health first aid training. It would be providing them with training that PATH does. It might be, again, tapping into some of those trainings that we know Mental Health America and National Alliance of Mental Illness do. And Amy and Taylor would be the ones that would be working most closely with them, that they would kind of be directing them and supervising and supporting them. So that's as far as we are, but I think we're off. I think we've got a lot there, and I'm excited about it, and looking forward to getting everybody really moving. Any questions about that?
Thank you. Bob?
Corey, thank you very much. What I just want to compliment on the approach, recognizing that there's also these agencies, everyone is so much at capacity. And one of the things that I personally struggle with, especially when we're looking at how do we focus on the underserved and the social justice stigmas, and how do we break through those and improve, is how do we actually make a change? And sometimes I fear that we talk about it, but we're not actually implementing it. And so some of the things that you identified, I just want to support, appreciate you trying to be practical and realistic, and actually identifying what we could do, because it's very difficult to go from concept to implementation in this area. And I appreciate that approach. Thank you.
Thank you. Well, we've got a good group, lots of good minds. Thank you.
Real quickly, Corey, did you talk about us with mental health first aid working with marine scholars and the AOK program? Okay, I apologize if I missed that.
No, you go right ahead. Thank you. I didn't.
Okay.
I just touched on it, but I didn't talk about what we were actually doing.
Oh, okay. So just real quickly, so marine scholars in the AOK program at the health department is the mental aid coordinator for the community. And so we're looking at, there's only, what was it, 6 to 8 mental health trainers within the community. And there's a lot of people that want to do mental health training. And so we're hoping to get more people trained to be the actual trainers, and also to go virtually to be able to do the training, because there's a lot interested, but not the capacity to do that. And Corey did talk about that as far as like the community liaisons doing that. But I just wanted to give also a quick update that Maureen in that group is meeting tomorrow. And so Taylor Davis, my behavioral health specialist, and I are going to be able to join their meeting tomorrow. And Maureen's going to bring up to that group what we talked about during the last marketing group.
And that might involve using some of that marketing money to help pay for a small portion of those trainings, because I think I explained when they took those trainings remote, the company that provides those materials and provides the certification and everything, they raised the rate quite a bit they want all trainers to be retrained in the remote model. And then they also charge more for the materials. So we talked about that we might pay a small portion of the increase in materials. So we would still ask attendees that are there to receive the training to perhaps pay $10 towards the materials, but we would make up the difference, which would be $15, because they raised it from 10 to 25. So in order for participants to still be able to come, we might pay for some of the cost of that. But again, that's something where after tomorrow, when they meet, we'll know more about how that's going to all play out and get some feel of it. But just wanted you to know that we believe that that's such an important part of marketing, because it is a way to help people know how they can help others seeking mental health. And it also is kind of a stigma reducing thing as well. So we feel that kind of meets that marketing, and we want it disseminated, and we need to figure out a way to make that still be able to go forward.
Any other questions or comments? Thank you so much, Corey. That looks like you'll be busy for a bit getting that up and running. Behavioral Health Policy and Funding Committee, Member Eisner.
Yeah, thank you. And thank you for that great report, Corey. That was a great meeting. And Amy, I'm glad you brought up the information about the mental health first aid, because one of the things we did talk about before I get to my report is that we have that money that was budgeted for this year, which we haven't spent yet. So we were thinking that if there's a need and we've got money already budgeted, we should try to use it. And that seemed like a good way to spend it, because apparently the mental health first aid program has not been really operating because of the need to retool. So that's it. We met on Thursday, October 8th, and we had a very long but productive meeting. I don't know if any of you have looked to see, but we received 20 proposals. And let me go back to my number here. I forgot. So I think 8 of them were embedded schools. Let me look at my sheet here.
11 embedded schools.
So 11 of them were for embedded schools. And then the remaining were for psychiatric, crisis management, PATH, Project Oz for drug substance abuse training and ending the silence. So we went through all the proposals and we ended, and let me just say that the ask for all these grants was $2,358,578. We have a budget of $1,143,623. So obviously we have about a $1.2 million short difference between the ask and what we have budgeted. We approached this from the standpoint of we have to live with the budgeted amount. So we started first with understanding that each and every program that submits an application, as you read it, you find that that program has a lot of merit and can do a lot of good in the community, but we don't have the money to fund all of them. So we thought we'd start with what are the ones that we think, wow, good programs, just we don't feel we can fund this year at any amount. And there were 4 of those. So there were 2 new applications for an eating disorder program, one for youth and one for adults. And while we understand that that is a big problem, we felt that this is a startup organization that we felt perhaps was not appropriate to fund this year. Maybe there's a way they can work with other organizations in the community to start to develop it, and maybe next year. There were 2 applications submitted by Chestnut, one for adult psychiatry and one for what is called targeted case management. And the adult psychiatry, unfortunately, was not a complete application. We decided that it did not, we were not prepared to recommend funding for that. And the case management program, we felt needed to wait till we could see the effect of the Fuse and the triage center and our current mobile crisis team and paths, rather than putting money into another case management program at this time. So that helped in the sense of reducing the ask, but we still have a $350,000 gap. I'll tell you now, we are not prepared to make recommendations. You saw the agenda does not have recommendations from our committee for this month. We're deferring that until next month, and I think we have all determined, while every agency would rather know sooner, that we need to take the extra time to make a good decision on what to do about the gap. And in particular, we were looking at looking at the embedded schools requests. We had some questions that needed to be asked about those. So we've also, we decided to invite those agencies that we have indicated that at least a willingness to proceed with considering to submit revised budgets if they wish. And I don't know if, Amy, that has gone out to them yet, but so we will let them know that we have $350,000 that we're short, and ask them if they'd like to provide us with anything that would maybe shave their budgets a bit. Clearly, one of the options we have is to do it for them, but we thought it might be wise to let them have a shot at it first. So that's where we are. We will meet again in November on our regular date, and intend at that time to be able to prepare a recommendation to bring to you for our November meeting, which will be funding within the budgeted amount. Clearly, when these things come up, we have discussions about, oh, could we add money to the pot through the unfunded, the fund balance, or reallocate money from other programs. And at this point, we consider our job to figure out how to do it within the budgeted amount. And, we can certainly be open to discussions with the board if there's some desire to look at adding money. But at this point, that's the direction we're taking, and we will be back with you next month. I don't know if there's any questions, and certainly invite, I believe all the applications are available to every board member. So if you've looked at them and you have any questions about them or thoughts, please feel free to email me. So I know going forward, I have not heard from anybody except the committee members at this point. So, any questions from anybody, or anybody who on the committee have anything more to say about what we did?
Any questions?
Just that it's always painful. It's very painful. And if anybody's got $350,000 lying around, feel free to pass it our way.
Great.
I just might add that the embedded skills program, having been such a success, we really want to continue. But there are some of the questions that we'll be asking about current providers that may be in the school social worker, psychologist. Some schools have already integrated those, and they are their employees. So that may help us a little bit in trying to decide which of those programs we are able to grant funds to.
Thanks, Judy. And yes, the other thing is, I think a few exceptions, many of the organizations also asked for more money this year than they had last year. So, we will be doing. Thank you.
Sonia, go ahead.
I had a memory lapse. Tomorrow is the meeting of the Blue Ribbon Panel, and the behavioral health group met a long time ago. Susan's sitting there smiling. Yeah, we met back on September 11th. It was like 3 days after our last board meeting, so I forgot all about it. Here are the things that we covered at that point. The Safe Harbor has cut their space in half to accomplish social distancing. So we know what that does for people that they can take care of. We talked about Fuse. There are 5 people that are identified in the Fuse program at this point, and only 2 have had emergency department visits now for medical problems. So hopefully, we're getting on top of some of that, and still working on how we can identify who are the right people to be in that program. The goal is to know what are the individuals that can be best served outside the social justice system. So we're working on that. Just know that the National Association of Counties has published the story about what Susan and John and the rest of their team did in putting together this mental health program. And that's a national exposure that we got with that. So that was a really good thing. The other thing we talked about is the upcoming forum. It's going to be different from what we've been able to do in the past when we were able to be there in person. So we're going to have several sessions, possibly 2 sessions a week. And we're looking at different times of the day because some people can't make it during the evening, some can't make it during the day. So that whole process is still in the works. The marketing is going to be tricky on this because we got to get the word out to a lot of people on what we're going to do. Going to be promoting it with churches and church bulletins, lots of social media and so on. So stay tuned as we get closer to definition and more details on that. We're going to probably have some groups of 5 that will come together in November to start planning on how we do roundtables. So we want to get that process underway. So anyway, Susan, anything else that you think of that came up? You're good?
Yeah, that's pretty good. On the forum, I got some information today on some of the planning And they actually did the same thing, I think, that Corey did with the Mental Health Advisory Board, kind of broke it into a couple of groups. And so they actually have a marketing group also for the forum to try to make sure we get the word out when we started. I think it's going to probably be the first week of November is what the first session I think that I saw on the calendar. And there's going to be quite a bit on COVID, but also it's going to be flexible depending upon how that situation goes too. So that was just something.
Okay, we're caught up.
Thank you so much. Thank you, Sonia, and thank you so much, Hannah, for your report. County Board.
Thank you. The county board passed the health department budget with very few questions. So moves on to, it won't be discussed again until November when it goes to exec in November. So, but the health department budget really didn't have any issues whatsoever. So that was good. And that was what we spent most of our meeting on. So.
All right. Well, thank you. For anybody have any questions? All right. So our next agenda item is the administrator's report.
Good evening. Can they see me? Oh, there I am. All right. Hello, everyone.
Oh, there you are.
So you got my report. So in that is updated information on our rural testing sites, as well as updates that were made at the end of last month on our contact tracing work plan. So just giving you a little update of where we are in some of those deliverables for that grant. So does anyone have any questions?
Susan.
Yeah, on the rural testing, I know you have it through the end of this month. And knowing that there probably might be surges this winter with holidays and stuff, is there any opportunity to look at somehow going out and doing the rural testing over the winter with Chestnut?
We're definitely exploring what we're going to do for the winter. So we have it scheduled out past the end of this month at this time, but hopefully I'll be able to bring you more information next month about what we're going to do with testing. But the Illinois Department of Public Health has mobile testing that's available that we can request in different communities. So that's another avenue that we can look into if we want to try to set up a testing site day in one of our communities.
Ms. Buchanan, did you want to? Yeah, go ahead.
Yeah, just a comment and a question. First of all, Jessica, thank you for this very comprehensive work plan spreadsheet. It really, I think we forget sometimes the extent to which you and the staff are engaged in trying to respond to this COVID. So it was very informational and very instructive for me. I have a question about many of the staff and contract people that were mentioned in that are part of the contracts we will be discussing under action items. And Madam President, is this, as well as Jessica, is it our intent to have discussion of those items under number 9 before we take the vote, or is it going to come earlier on the agenda? Because I do have some questions about the various contracts.
I think for ease of following the agenda, if we could discuss it when we bring the action items up.
Very good. Thank you. Well done, Jessica.
Anyone else have questions? All right. Then we're going to, don't go too far. So for our discussion, for our informational items, we're going to have a brief discussion of planning to manage a possible winter COVID-19 resurgence. It's something that Jessica and I kind of talked about a little bit. mostly we're gonna try and get a group together with ISU so we can address the issue of the students coming back after Christmas break, because they're going to be off campus effective from November 20th through January, some like the second or third week in January. And then ISU is going to have spring break. So when they come back in March, we're going to have a repeat performance of September. I think we need to get together with them and figure out what they're going to do about that issue. Is there anything else you want to say? Go ahead.
Hannah?
Oh, I'm sorry, Hannah.
Well, yeah, and to Jessica too, I guess this thought just occurred to me when you talked about the ISU. Through I know that our numbers, we looked like, wow, we're dropping, and then of course we go back up again, and some of this seems to be related to the long-term care facilities, but are we getting any sense that some of the ISU spread has now become community spread? I mean, is there something in that? Can we see from our contact tracing that might have happened? And, as we talk about dealing with them coming back infected again, that we can address as a community?
Yeah, so I mean, we've had COVID in the community the whole time, and we saw obviously a surge in late August, early September, and so the more COVID that we have, the more chances for that to just spread in the community further if we're not able to use those tools that we have. So contact tracing, isolation, quarantine through that, and testing, and personal responsibility. So individuals taking those measures to prevent further spread. Did we see community spread from that? I don't have direct correlations to say that this person then the spread was to this person, but I would confidently say that we've had community spread from just our surge of cases. And again, it's been here the whole time. So there are of the cases that we have detected through testing. We don't know about cases of that we haven't identified.
Judy, go ahead.
And shall I assume, or shall we assume, that in the conversations you intend to have with ISU and the plan, that it would include fairly aggressive testing following each of their breaks, so that when the students return, it is very clear that we'll get a good picture of who may be infected, who may not, and doing that, sort of at quick intervals soon after their break. Is that is that going to be part of your discussion?
Yes, and I do know that ISU will be starting the saliva-based testing, so the results come back fairly quickly. 15 minutes? That doesn't sound right.
I'm not sure what the
I'm just trying, I read it. I should be able to remember it because I read it, but I just don't remember. It was in an email from Dr. Dietz. Okay. So they're it's much quicker. So it's not it may be a couple of hours, but it's not 24 hours. So it's like a very quick turnaround. So that will allow them to identify who's positive, who's negative. It's got a pretty good sensitivity.
Okay, well, that would raise another question. Once that is known and public information, is that a test we will be using? And if not, why not?
Really, our focus has been on contact tracing, case investigation, and we're starting to focus on mass vaccination. So, I hope we can keep our buckets full, and not have too many where we're not able to fill each of those. So we've been very limited in our capacity to do testing, just based on the staff that we have. But we don't have any plans at this moment to do any saliva-based testing. I have on the agenda for later about other types of testing that will be available, but the saliva-based testing we haven't looked at exploring.
Thank you.
And that would come through the lab. And it just got its emergency use. Member Schaefer?
Thank you. Couple of things. One, there were some good articles about contact tracing and interviewed 4 contact tracers. That was pretty informative. I thought that was very good publicity for us. So when we're talking about, ISU coming back and possibly, holiday surges and whatnot. I know that we're going to have like 40 contact tracers by the end of the month. And that I remember that we were supposed to have like 60 eventually. And so can you give us an update on how that's going to happen, or if IDPH has said anything different, or what any challenges that there are in getting another 20 to be prepared if we have a big surge from holiday travel, 2 weeks after Thanksgiving and 2 weeks after Christmas. I mean, basically starting at Thanksgiving, we could probably see a lot of different, spikies, going on because Thanksgiving and Christmas and students coming back and then spring break. So can you kind of give an update as to how we're going to be approaching that, or what challenges that we might have to look at as a board to address them?
So I'm actually awaiting information from IDPH where they have given, based on a formula they're using, the number that we should have. So looking at how many contact tracers we have in place right now, if we are where we should be. And so that's something that I'm awaiting. It should be coming any day now. But looking ahead, challenges for us, when you go through that kind of roller coaster of cases, is bringing on more than we have now. So we do have 28 contact tracers now, and we're bringing on an additional 10 over the next 2 weeks. So, they are managing our cases well. And, one challenge would be space to put them. So we're right now exploring some options within our building to be able to move some of those personnel that may free up a little bit of space for some more, but space is limited within our walls. Also technology. So, having enough contact tracing, it takes a computer, it takes, a headset because it calls through the computer. It takes, internet. So technology is a challenge, and just having the supplies that we need for, if we were hiring more than 40 or 50. Also, keeping 50 plus individuals on if the work is not there. So like I talked about that roller coaster, in times where it's a little bit lower, making sure that we have work for them to do, and then making sure that we have enough qualified staff in place at all times. So some of those challenges we're looking ahead to try to meet, but also the Illinois Department of Public Health, like I mentioned last month, we are going to be adjusting and amending the current grant for contact tracing. So it's going to be rewritten a little bit and budget adjusted as well. So that's a challenge, is really not exactly knowing what to look forward to in the future. But that also does give us an opportunity to take this time right now to assess, plan ahead, maybe look to, if we wanted to be able to bring on additional contact tracers quickly, we know now about how long it takes for us to hire them, get them trained, and have them ready and active.
Who else had a question? Tammy? Go ahead, Tammy.
I can't remember if it's ever been shared. If it has, this is a reminder. There are also an additional 15 to 20 health department staff who have been trained in contact tracing and case investigation. So they are also available. Many of them could be reassigned to do just that in place of their regular job duties if we reach a spot where we have to do that.
Who else? Sonia, go ahead. Oh, do you have a comment? Oh, you're good. Corey.
I'm just wondering whatever happened to, we had talked about last month's meeting investigating situations where people were in violation of, mask policies or whatever. And I just wondered whatever happened with we were going to kind of look at a procedure in place and deciding who was responsible for what. And I just wondered how that got sorted out and if somebody could update us on that.
I'm thinking. That has been sorted out and the process has been put in place, and we'll have to discuss that at another time, one-on-one over the phone.
Okay, thank you. And then I just had one other question, and that is to Jessica and everybody. Are you concerned that, you always worry about when holiday time, some people that are working might want to be off during holidays? And are you going to have any issues with maintaining all of the contact tracing responsibilities during the holiday season when people are wanting to, actually enjoying holidays? And do you have a plan for kind of how do you flex schedules to accommodate all of that? Because the COVID is not going to stop, I'm afraid.
I don't believe it will either. But we'll do everything that we can and we normally do to look ahead. We're bringing on those additional staff now so that we can schedule out and look ahead and try to get people time off, because everybody does need to step away.
Especially given the amount of overtime. Judy, go ahead.
A question regarding the 28 that we now have on board. Does that include the people that are Illinois State, or are they a separate group of tracers?
No, that does include the 5 that are currently at ISU.
Does include them. And I noticed the question about the holidays, the way we used to spend them. IDPH has come up with a plan, so it will not totally eliminate it, but I did see that Amy Brooke and others are working on something. Will be on social media, reminding us, if you are entertaining and what, it's just kind of a reminder of nothing new, but encouraging people, if they are celebrating, if they are going with family, that there's some things they need to be aware of. So I was glad to see that. Do you anticipate trying to work with our local media, print media and radio in terms of, here's the plan for the holidays, and acknowledging how tough it is for people going into the winter and the holidays, but the message has to be constant. Do we, and I know, are you going to talk about a communications plan tonight, Jessica, or?
I don't have it on the agenda tonight, other than
I know it's happening and I know you're working on it, so thank you.
Yeah, we're definitely looking ahead at the holidays, and we have been for a little while, knowing that IDPH has been good also about putting out information of, this kind of, now I don't want to call it a new normal, but knowing that the holidays, they're not canceled. So how do we do these things as safely as possible? So COVID's still here, but these holidays will still happen.
And I guess to that point, and I've encouraged Jessica and others, I think we need to continue to take the lead on that kind of information. So IDPH and CDC are providing it. So I'm glad to see that we're working through it, because I think we are the expert in that, and we need to take the lead and accept that responsibility. So thanks.
Hannah, and then Bob. Hannah.
Thanks. Thank you, Corey, for bringing up the question about enforcement. I had not thought about it. And I guess I would like to know more. I'm a little concerned about on the phone. I assume we have something we've sorted out in terms of either Tom's suggestion or request to enforce it through our code, or whether or not we can enforce it through the administrative guidelines. But we don't have to address that tonight, but I would like to have some information on that. Perhaps we can bring it to the next meeting.
Samantha's going to give you some more information.
Okay, well, can I finish and then I'll.
Oh, sure.
I've got another, just an unrelated question for Jessica on the staff, the contact tracers. I wasn't sure, are these folks hired as full-time benefited employees? They're 35 hours a week or whatever, are they? So one of the thoughts I had is, I know a lot of the lead time is the training. Is it reasonable for us to consider putting something out and whether people will respond to say we may need them and go ahead and get people trained? So if we really hit a huge need, we can bring people on quickly instead of waiting and then having to delay it through the training. And I guess, if people know that the hours are adjustable because due to need, then, we ought to be able to send people home if they need to go home, or I'm sure there's probably other things we can do, but anyway, I just thought about maybe looking at doing some training up front before we hire people even, or, moving that direction. But thanks. So that was my other question, but yeah, Samantha could share some information, that'd be great.
You're not out there.
All I was going to mention is that we have had conversations with Mr. Anderson and Ms. McKnight, consulting about the best course of action on these topics. So I just wanted to update you that those conversations have happened. They're continuing to happen, and we're continuing to work together to figure out the best way we can do this with the health department and giving them the best advice.
Bob.
I just wanted to amplify what Judy said about what the Board of Health can do for the winter resurgence concerns. And I think that is to be innovative, reminding people that the hygiene continues through that, but to do some kind of media cooperation to get people's attention. Otherwise, I think people are becoming numb to hearing that. I think people are complying in the whole, but I think it's an opportunity to freshen it up and really hit that hard. So I'm just, Judy was saying something that was on my mind. So if we can do the promotion and teaming up with whatever resources, I think that's a critical responsibility of the Board of Health.
And that is, I think, something that we're all aware of, that the COVID-19 fatigue, I think that's what I've heard it called, is getting, it's already here, and it's going to get worse before we have a vaccine that's going to help us out. Okay. I think we've done the discussion of the COVID-19 messaging, because we're going to try to work on some, and she's going to try to work on some holiday messaging and try to get we're going to put some of this, oh, I'm sorry, Hannah, we're going to put some of this on the website. While I'm thinking about it, take a selfie or have someone take your picture, email it to Amy Brooks, and so that she can put it on the website with your mask on, okay? Because Board of Health is masking up. Hannah. Go ahead.
Yeah, I just was going to ask somebody to take a look at the website. I think just as you open the page, a lot more direct messaging about masks would be nice. The pictures that scroll in the background are fall colors. It's lovely, but I bet you there's some pictures of people in masks that could scroll. Things that just send messages without even meaning to are useful. And I think we probably have funds to do some bigger things, like look at some of these lighted billboards and really stand out as a leader in the community, which I would really like to see us go forward with. I mean, I know everybody knows, I think the science is clear of the effectiveness of masking, for example, and all those signs are getting tattered that are at the entrances to the grocery stores. And I agree with Bob. I mean, you see a lot of people wearing masks, but it doesn't hurt to remind people and to let them know that, you know, we're a resource and a leader in this area. So I know there was mention in the report, the contact tracing grant report about communications, and that a meeting had been held, I think, back in July with It's Be an Advantage in the Chamber of Commerce, or they've got some banners up around town that are, you know, they're trying, but they're not very visible, and they're kind of set, you know, blowing over in the wind. So I didn't see that we were a partner in that. So I would like to see us go forward and partner with them. And if we can give them be a partner in terms of funds to really get some bigger, brighter, more beautiful messaging, that would be great. So.
Yes, yeah, we do have a health department employee that is that participates in the group that meets and plans the communication. And you know, we've had conversations with the chamber about how we can partner and assist them with just getting messaging out. And our public information team at the health department, they're currently seeking information about advertising and different media, so billboards, PSAs. So I hope to have more information and really something visual to show you for next month.
Judy?
Yeah, and thank you. And I don't want to belabor this because I know Jessica's working on this communication plan. But in the tracing work plan, it was mentioned about outreach and PPE distribution, and that we are providing masks, for example, when they are requested. Can you talk to us a little bit about how actively we have been in reaching out, actually not waiting to be asked, but helping particular communities where we know there are some disparities, help them by actually going to them to share the information and to provide whatever PPE might be appropriate. Can you talk to us a little bit about that, Jessica?
So I guess, can you clarify for me if the PPE, I think, mentioned in part of the work plan is through the Take Cover initiatives, so face coverings, so homemade face coverings that we had donated or purchased through the Take Cover initiative to then give to community agencies that serve the vulnerable populations. Is that what you're, because then we also do supply PPE.
That's part of it. For example, you know, we talked about the Chamber of Commerce helping with the messaging and with remediation. What about our outreach to other organizations that might be, you know, in some of those communities where we know that there are some disparities and perhaps not the kind of resources that, say, the Chamber may have? Are we reaching out to Western Avenue, to groups like that, the Boys and Girls Club, to make sure that their families, obviously they're aware, but do they have available information? Do they have the opportunity to get the face coverings that they need? You know, are we going there rather than waiting for them to call us?
So Take Cover initiative, we're getting ready to do some more promotion of that, and we will definitely look to those agencies, because again, yep, Tammy, I was going to ask if you might have, if you have anything, because I know we were just talking yesterday, I think, about.
And before Tammy begins her comments, I'm not suggesting we add another layer. There is plenty on the horizon for all of you. But that is the question, particularly early on in the COVID, this community was dealing with a lot of conversation about the disparities. And I was reminded of that as I was, you know, kind of preparing and reading for tonight's meeting.
Go ahead, Tammy.
So I have been in charge of the Take Cover initiative, which is the homemade face masks to be distributed to organizations who serve underserved populations. It was never the intent to hand out individual masks, which we've had requests for, but we've referred people back to an agency that they're affiliated with, and we ask the agency to make more of a bulk request So we have, I wish I had my list in front of me, but when the initiative first began, we made announcements on social media, any of the local email serves that we knew of, it went out there. I believe we collected just under 3,000 masks, and we have distributed right around 1,000. The request for them has kind of hit a lull, so it is time to refresh the messaging, get it back out there. So I did just see a message today from Amy Brooke and the PIO team that will be going out very soon. If it hasn't already, it might already be out there. So I'm hopeful because I have a mountain in my office that I would like to get out there and go to a good cause. But we'll try to also think of some other innovative ways to get the message out.
Sonia.
Yeah, I'm responding to that. I did see a message on social media from the McLean County Nursing Home asking for masks to be made available because they were washing and drying and so many people there and they were not going to survive. So I personally had a bag of masks that someone had graciously made and I took it out there. So some of us are just delivering directly to the agencies as they make a need known. So that was how I saw it and what I did with it. I don't know what they've gotten, whether their need has been filled or not.
Thank you, Sonia.
You're welcome.
Hannah. Go ahead, Hannah.
Thanks. And this is a question maybe to you, Carla, but, and first of all, certainly understand, I know just trying to get up and running and understand keeping track of numbers and contact tracing is a big job, and appreciate all the work everybody's done and understand that. I think the comments tonight reflect the fact that we also have a big job in health promotion, and this is just a really unusual situation for us. But I think it's an opportunity for the health department to really show what leadership what we have, what wonderful staff we have, and skills and knowledge that we have. And I think we just need to do it. I think we've been a bit on the, I'm sorry, to sort of helping side of things. And I think we need to move into the leadership side a little bit more. And on the messaging, I, as a board member, have every confidence that Jessica and your team can come up with plans and research avenues so that by November we've got things going. You don't need to come back to us to get that approved. I mean, in my mind, I think and I don't know how other board members feel, but I wouldn't want you to feel held back because
I just want to be able to
needed us to approve it.
what we're doing and even what's already coming out, or so just give you, in a communication plan where it says, like, here's the message, here's the mode, and here's the audience. So just showing you what messaging we're using, who we're trying to reach, and just give you that background. So it could be things that are already happening.
Okay, great. I misunderstood then that you were just gonna bring a plan. I mean, I know that you guys know what you're doing, so.
Judy, go ahead.
I just, like the Take Cover initiative, I was not aware of that. And so I think in kind of a thought to the last points, where I said we should take the leadership. I think we are the leaders, but we need to continue it. But there's so much going on that we don't even know about. And to the extent we can, I think we'll be ramping it up.
Tammy, go ahead.
I just have to say one quick thing. We partnered with Illinois Heart and Lung on that initiative. It wasn't ours alone. So they were a partner in that initiative.
Any other comments? I missed an agenda. I missed a discussion item in terms of we had a vacancy on the Board of Health because Rose Stadel resigned. And I noticed that, or Hannah drew it to my attention that an Andrew Held was on the county board agenda. And I assume he was appointed.
He was approved through exec and it still has to go to the full board next week for final approval.
Okay,
So he would be here for our next month's meeting.
and I'll try and get some information and some background on him and some, because I don't know anything about it. Go ahead, Judy.
Well, and I might just mention, Carla, because I did just recently check in with John McIntyre when I noticed this on the agenda, and he apologizes to you especially that he just simply didn't get to you, but he feels pretty confident that he has a great nominee and that will be a strong contributor to our discussion. So it was just and one of those things when you get busy, he forgot to notify you that he was ruling with it.
Yeah, I think you'll really like him. I think he'll fit in well.
Oh, good. Are there any other questions or comments? We're going to move on to our action items. You ready? So the first action item is approval of the local cure program financial support certification, and that's in your packet on pages 12 through 20. Susan, motion or question? Sonia, second. Discussion, questions? Hannah.
And this is just a general question. There's some talk in there about if you don't use it all, you give it back. And I don't remember seeing in there the amount that's available to us. And I guess I thought, again, we don't have to discuss it tonight, but we've got the COVID grant. There's different grants we've gotten, and I haven't done a very good job of keeping track of them. Could you just send us an email or something of the dollars that are involved in all these grants, or if you know off the top of your head? I just don't remember it, and you helpful to remember.
She'll give you an estimate. And then she'll
I know
give you an exact.
roundabouts.
It is hard to keep track. It is difficult.
So the COVID crisis grant that we got was about 93,000. Then COVID contact tracing is 2.8 million, and cures money is about 228,000.
And as you saw in the contract, it has some very specific things that can and cannot be charged against it. Any other questions? Thank you, Hannah. All right, can we move to a vote? Amy will call the roll.
Carla Cole,
Yes.
Corey Tello,
What?
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
You're wrong.
Yes.
and Susan Schaefer.
Oh, okay.
Yes.
Motion carries. Next item is approval of the Illinois Children's Healthcare Foundation grant agreement, and kudos to Tammy.
Mhm.
Go on. Darn it.
I so move, I think.
Second. Thanks, Tammy.
Thank you so much for applying for that. The motion's been moved and seconded. Any questions? All right. Amy, if you call the roll.
Carla Cole,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Motion carried.
Motion carries from here all the way down, or just a contractor, which is G. Right, that's fine. Perfect.
So you can request a motion for all of them together?
I was just getting some assistance on the contract. So if we could consider items C, D, E, F, and G, since they all pertain to contact tracing, if we could put those all to, and COVID, if we could put those all together and have one motion for item C, which is approval of contact tracing coordinator grant, the supervisor, the team leads, the call center representative, and the data entry specialist. So C through G. Sonia?
Move.
Judy, second? Okay, discussion? This is where, Judy, you had some questions?
I think many of them might have been answered, but I did note there's a lot of reference to quality improvement measures. And I'm glad to see that because it looks like we're gonna have a lot going on. The contract tracer coordinator will be overseeing, as I understand it, the supervisor and the team lead people. Is that correct?
Yes, and I apologize because in my memo I said and organizational chart, and then I did not include that. So yes, the contact tracing coordinator is over the contact tracer supervisor, and then all of the contact tracers are underneath the team leads.
Okay. No, and I think the other questions as we've gone through the previous discussion were answered. So thank you, Carla.
You're welcome. Hannah, you're not off the hook.
I had a question. So these are written to be contracts and contract employees. It's as said in the, however, there's a rather detailed description, and I don't know if Samantha's still there. I assume that legal did review it. But that's not my question. My question is that we state an hourly rate, and I did not read in there, and I could have missed it, that there's any expectation of a minimum or maximum number of hours. One of them, the call center rep, limits the hours. Are these anticipated to be people who will be working as if they are full-time? I mean, there's a set, what caught my attention was that the provision that this did not preclude them from doing other work. So, but I assume they're going to be housed at the health department using our supplies and equipment. And the expectation is that they would provide us with a certain number of hours of work, which I didn't find in the contract, but maybe I missed it.
Yeah, the specified hours of work is not listed in the contracts of what that maximum is.
So I would suggest that we should insert some expectation. I mean, at this point, they bill us if they choose to come for 10 hours a week or 15 or whatever. I mean, I guess I feel like we should make it clear if we're entering to a contract with them, what our expectation is in terms of the amount of time they will devote to working for us. Another issue, a question I had is I don't see any requirement that any of them provide us with proof of insurance. There's a clause that says they'll indemnify us. And honestly, I think a $14 an hour employee or contractor is going to not be able to indemnify us for much. So if indeed we're really treating them that way, then I would think we would want some proof of insurance in the event we get sued. And they're dealing with confidential information and in an area where I think we could face some exposure. Let's see. I think those are my questions. My main concern, though, is not having some statement of how many hours of work they're going to perform for us.
Yep, they're all here.
Hang on just a second.
Some of the contracts do have a clause to insert for no more than X hours per week.
I think that was the call center rep contract. No, the team lead and the call center rep have those, but not the other. So,
well,
I mean, max is fine too, but I would think we'd want at least a minimum amount, or if our expectation is they're going to work whatever 37.5 hours a week, then we got to tell them they're going to do that and they ought to commit to it.
Well, I guess having been a contract worker in different circumstances, the expectations were very clearly spelled out, but there was never, you get them done, and whether it takes you 10 hours this week or 25, or you wrap it up in 2. So I don't know that it's that unusual with contracts not to include numbers of hours, as long as the expectation is very clear. The indemnify information, in Hannah, I also made the assumption that legal has looked at these. And I don't know if they feel, I would suspect that they feel that we are good with the language that's in there, but it would be helpful maybe if we could hear from Sam.
So I was just grabbing the packet from Jessica here. She's got the contracts in there. I think as far as it for the hours, part of that was to give the county a little bit of flexibility with our application. So each of the contracts are directed by the health department as to what their duties will be. The health department will give the training and all of that. And it kind of protects us a little bit from having the mandatory minimum hours and maximum hours, so that we can flex with the needs of potential surges or anything like that. That's the question that I remembered about the number of hours. Could you ask me again what the other portion of the question was?
It was about the protection we have in the event that some of the very, the information that they're accumulating is somehow used inappropriately, or that they handle themselves in a way that would not be considered appropriate.
Right. So each of the contracts, to my memory, can be terminated basically without any cause. And they also are generally promising to abide by any laws, including HIPAA. So if they have some sort of medical information that would not be able to be distributed because they're, if we fall under all of the qualifications of a covered entity and we go down that path, they're still supposed to be abiding by that, as anyone would under those circumstances. So we can certainly change the contract or amend it as you want to, but those are some of the reasons why, as well as, every Illinois and federal law as it deals with employment, the Illinois Human Rights Act, the Equal Opportunity Employment Commission, and all of their provisions, those things are almost implied. But anytime that we are dealing with this, if something does happen that we aren't satisfied with, the termination clause in there makes it very easy to get out of this contract with that person.
Tammy,
Sam and I,
hang on a second, because Tammy wants to talk
okay. Oh, sure.
first. I can tell when she comes on the screen that she wants to talk.
Pop up.
Tammy.
So also, just to reassure you that each employee that is brought on, or contract employee that is brought on, does receive HIPAA training, and they also do sign a confidentiality statement or confidentiality agreement. So it is explained to them in further detail upon hire.
And thank you, Tammy, and thank you, Sam. I really do trust the judgment and the work that you guys have done on this matter, but this was more for my curiosity and just to confirm things. So thank you.
Hannah, did that satisfy your questions, or do you still want to do an amendment?
Well, I guess I understand what Judy said. It's not unusual sometimes when you contract to do a job for somebody and it just, you take as long or what. But I think what we're doing here is we're bringing people on to work for us with a certain expectation of hours, and we don't want to leave it to them that says the contact tracing coordinator can decide how many hours a week that he or she needs to be there to perform the work. It's our choice to have them there. So, I think at least setting, and we don't have the max. So I think I mean, these are unusual. I understand the idea behind it, to have these contracts to say you're a limited term employee, you know, May 2021, you're done, right? That's the way they're written. So it's a pretty short term at this point contract. But it's kind of an unusual, it's not in my mind clearly an independent contractor arrangement as some others. It's more a way, I think, to say your employment is only based on the grant terms or this May date. I think it was the earlier of those. So I guess I would feel more comfortable saying you're expected to, we've delineated every other aspect of their work for us. So to not put the hours in just seemed to me odd. So, you know, obviously I assume they'll be here working and they want to earn money, but you know, I mean, I don't want to create a holdup, and I don't know if we have some hours that we would feel that we could insert into those, or the maximum hours and the ones where it's stated are not listed. So I would think we should put a number in there if we had one in mind. So.
You can put a minimum in there. Do we need to bring this back to?
A couple things.
Can't we just do an amendment?
You could do them on its face and vote on it that way, and then write it in, that's fine. But there'd be a motion to amend with a specific amendment, a second to that motion, a discussion, treat it like that, and then you go back to the original discussion, motion to approve or not that particular one. Also, this is a motion for a bunch of numbers at the same time. So at this time, if there's one particular one to amend, move to take that out and then deal with that one. Or if you want to amend all of them at the same time, keep them together.
Okay. So Samantha was just giving us a roadmap on how to proceed. So Hannah, do you want to amend, which of the contracts were you thinking that we need to put hours in? Not the call center has hours, right? I thought I saw hours on the call center.
She's muted.
Unmute you. Hannah, you're muted. Sorry.
Sorry. The call center contract and the contact tracer team leader contract. I think maybe only the call center had a place where it says for a maximum number of hours, which was not filled in. So, but I think the same language could be put in each of the contracts. Let me go back and look. So.
Carla, can I chime in here for a second?
Sure, go ahead.
It's Chris Spanos talking.
Go ahead.
I sat and listened long enough without saying anything. As a lawyer, we kind of tend to explode if we can't get to say something. So I haven't seen the contract specifically that you're referring to. If I understand Ms. Eisner's question and her issues, it's with respect to controlling the number of hours. It seems to me that we're going to control the number of hours regardless of whether or not it's added in the contract. It's not like there's going to be a contractual right on the other side to say I get to work more hours. By putting a cap in the contract, you're actually limiting the health department as opposed to helping them, in that if there is an emergency situation or some situation comes up that requires more hours than what you're contemplating, then you'd have a contract issue with the person if you were to try to require them or request of them to work additional hours. So, I mean, you're free to amend the contract as you see fit. I just thought maybe you would want to consider the fact that you're going to control the number of hours this person works. So adding in a maximum number of hours limits your control more than limits their work. Just a thought. You also raised an issue, if I remember correctly, earlier you raised the issue about insurance. You mentioned indemnity and then wondered if there would be an insurance requirement. And again, I am limited because I have not seen this particular contract. But if I understand the context correctly, requiring an individual to carry insurance is probably problematic because of the limited. When you think about have I got that right? Did I get that right?
Yes, I believe you did.
Okay, so when you're looking at somebody who you're going to pay about $15 an hour to obtain some sort of liability policy to cover their potential exposure, once they go to their insurance agent to look into a policy like that, they're going to realize that I'm going to make, if I make any money, it's not going to be very much when you net out the cost of insurance versus the number of hours that are going to be worked. So it's one thing and absolutely appropriate if you were working with a staffing agency or a company to make sure that they had liability to cover their employees. Under these circumstances, when they're independent contractors coming in individually, asking them to acquire their own liability policy would be, I think, very problematic and more than likely will reduce the number of people that are available to take the position like that.
Yeah, this is Dr. Genetti.
I agree.
Hannah, just a second. Go ahead, Dr. Genetti.
You know, I don't know about the insurance policy, but I would not be in favor of putting hours in here. I mean, you don't want to guarantee a minimum because we don't know if we're going to need them, and we surely can't predict what's going to happen in the future. And we may need them 40 or 50 hours in a real crisis. So I understand the concern, but with what we're dealing with, I don't know how we can really accurately pick that.
And
Okay.
so if I may maybe ask Chris this question as well. I mean, I understand exactly what you're saying about the insurance. The contract does say that they will indemnify the county, and that's what brought it to my mind. I don't think it's reasonable to expect a $14 an hour employee to indemnify the county. So what we have are contract workers. What is our exposure as a county or the Board of Health? I mean, if they breach the contract or they violate HIPAA, they're not our employees. Obviously, I guess we get sued in the event that we've hired somebody as a contract person to do this work.
Typically, I'm sorry, I didn't mean to cut you off.
No, that's okay.
Okay, I apologize. Understand this, regardless of what we put in the contract as a label for our situation, the law may find that that because of the nature of the relationship, they're actually an employee and not an independent contractor, depending on how much control we're exercising and other factors that go into a legal analysis as to the relationship in the first place. So that's number one. To answer your question, as far as our liability for an independent contractor, if indeed they are deemed an independent contractor and they are indeed acting on their own, basically that we are not controlling them to the point where they become technically our employee, then the county's liability in theory would be limited. But like all lawyers, we always have to qualify that and say, listen, it depends very much on the individual circumstances, the facts related to that specific situation. So it's a good idea to have an independent contractor contract. It's a good idea to monitor that relationship so that it doesn't become an employee-employer situation, even though you've contracted for an independent contractor. And as long as it stays an independent contractor, the county's liability should be limited, if any. But again, it depends on the situation and the facts. I hope that answers your question. It probably doesn't make you feel any better, but it should at least answer your question, I think.
Well, and I don't want to belabor it, but I guess your original point is what I was getting at, I think, is as the contracts are written, they're very specific as to what they are expected to do and the training and the provision and et cetera. I mean, you know, what goes on in determining whether somebody's truly an independent contractor. And I understand the county's desire to time limit the employment. So it's, as I said, it's an unusual contract. And, you know, I'm not going to belabor the point if the group feels comfortable without the hours. I just would hate to see our contact tracing coordinator come in and say, well, I have 3 other of these contracts and I can only give you 10 hours a week this week. Yes, we can terminate the contract, but then we're now back to square one of having to get somebody else to do the work. And I'm sorry, I can't help being that person who thinks of the worst case scenario. So, yeah. The truth is probably nothing like that will ever happen, but.
Don't say that.
But it doesn't give us any it doesn't give us any commitment to work X number of hours and, but anyway, I will certainly go with the will of the group if people are comfortable without the hours, and I would withdraw any request for that.
Contract and just remove that. Okay.
I'd like to call for the vote, and just with the discussion, I think our legal staff will take extra look at this and proceed forward appropriately.
Okay, if we could vote, I'm just trying to remember what Samantha told me we had to do. We need to amend the call center contract. So let's take item F out, and so we can, question's been called. So we're gonna vote on item C, D, E, and G. I'll tell you, yes, Susan.
Can I have a clarification? This is as they are written.
As they are written.
And then in another question then, is the reason for excluding item F because we want to amend it and take out the hours?
Yes. Take out that sentence about the hours. That is correct.
Okay, all right, thank you.
Tanya,
Can we approve it with that agreement that comes out? So you have them all approved?
it has to be done separately. You said it
All
had
right.
to be done
All
separately.
right, we're gonna do it all tonight, just separately, fine. Thank you.
All right.
Let's go.
Okay, so we're voting on items C, D, E, and G as written. Amy?
Right.
Cole,
Yes.
Corey Tello,
Yes.
Anna Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Motion carries unanimously. Now to amend the item G, the approval call center representative contract, and Jessica has suggested that we take out the first line in that contract where it where it specifies maximum hours. And I need a motion and a second.
Yeah.
Tanya.
So moved.
Judy, second. All right. Any discussion on that one?
Just to be clear, that's on page 41 of the packet. Is that what we're talking about?
30, I think. So hang on, let me see if I can find it really quick.
40, it says.
It's before,
Packet.
Isn't it item F on our agenda, 9F?
yeah, it's item F.
No, I know, but the language is on page 41.
Uh-huh. Oh, yes, okay.
Yeah. No, the language is on,
It's in both of them.
okay.
So F and G.
Are you sure?
Yes. Unless that's a duplicate, because it does have the same title. So page 43.
Can you hear Jessica's page 40, 43? I'm not down.
I've got 41, number 4 on the bottom and extends to 42 on the top.
I'm sorry, Dr. Jada, say that again?
I got 41 on the bottom, number 4, that extends to 42 on the top.
Okay.
But what about page 39? because I thought we skipped F.
Mhm.
Did we skip F?
Yes.
Yes,
Okay, so that would be page 39.
But it's also, unfortunately, it's also on G. What are you guys seeing?
We vote on G?
So
Yeah,
This is
unfortunately.
G, page 41, and it also, it's got an error there. Then it actually says that no more than hours.
All right, so let's do these one at a time. So let's look at F first. That's the call center representative. What page?
39.
Page 39. My number's not coming.
I recommend that we end number 4 sentence, at an hour rate of $14.14, period, and remove the remaining.
And remove for no more than blank hours per week.
Correct.
And that's item 4. Number 4. Sonia, did you want to say something? Judy?
nope, you're just ready to go with the motion.
You're ready to go. All right, so item number F, we're going to amend that contract so that on page 39, the wording goes, provide compensation to the call center representative of an hourly rate of $14.14, period.
Gotcha.
Motion, but not a second.
I need a second.
Got it.
Judy, okay. Any more discussion, questions? Writing.
Carla Cole,
Yes?
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes,
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Motion carries. So on item G, approval of the data entry specialist contract, I need a motion to reconsider.
And discussion.
Judy, so moved. Is there a second?
Second.
All right, so on the data entry contract on the page 40.
The top of page 42, bottom of page 41,
I'll keep me up to print these things out.
and then on page 42, anytime the title of the position is listed, it says call center representative, and it should say data entry. So number 3, 5, 6, 8, 10, 11, and then page 43 at the bottom.
This is, it's that on.
Also on page 41 on number 4.
Was this one happen hourly also?
So that's on the bottom of page 41, and then the top of page 42 is the hour per week.
So on the bottom of page 41, it will be provide compensation to the data entry specialist an hourly rate of $14.14, period. It would be, the rest of that sentence will be deleted. Everybody following this? You good? Okay, good. We got a motion in a second, right?
Yes.
Okay, so Hannah,
So right now, I think we have a motion to reconsider, right? So do we need to
Yeah.
vote on that first?
oh, okay,
Put
Right.
another,
thank you,
Motion.
Hannah.
sorry, it's very confusing. And the motion then to amend the contract, can I just suggest that we refer to the removal of that those words for the pay, and that just as a blanket say, any place in the contract which refers to this as call center representative should be replaced with data, instead of trying to list every page where that is.
That works. Okay, so let's vote on the motion to reconsider. Amy?
Carla Pohl,
Yes.
Corey Tello,
Yes.
Anna Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Sonia?
Yes.
Okay.
Susan Schaefer.
Yes.
All right, motion carries. Now, motion to amend the data entry specialist contract for the wording on page 41 and throughout the contract to replace the Senate representative with data entry specialist. Is there a motion?
I'll move.
Thank you, Sonia. Corey, second. Any further discussion? Amy?
Carla Pohl,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Motion carries. Thank you for everybody for your patience. Thank you very much, Samantha, for the assistance. Is there any other discussion or comments for the good of the order?
We have number H,
H. Oh, I'm sorry.
the letter H.
Letter H, I'm sorry. I need a motion for, thank you so much. God help me. Approval of the statement of work for provision of wellness. Is there a motion?
So moved.
Signed. Judy, second. Any discussion? Hannah?
I just would like some clarification. I'm gonna get to it here. And section, so the introduction, 3-point, the tasks, if everybody's looking at it. There is a bullet point that says provide a database for all users with company assigned username, first name, last name, email, location, date of birth, and gender. I'm a little uncomfortable sharing, and that's all of our employee information being given to this organization. I understand. It sounds like what they're going to do is just send emails out to people, and on 6.3, give people, some options to participate in their programs. I'm just not real comfortable with, and I know this can come up at times as to how much of that data we want to share. Don't know what other people feel about it. I guess I'm asking that as a question. And later in the contract, there's some reference to information assets. I mean, I assume this could become, a mailing list for other products they may sell. So kind of wondering what that's in there for. That's my question. It seems, I don't know, it just seems like there've been other instances with contracts like this that we would not want to share all the employee personal information. I don't know what they're doing with it, unless,
I don't really know much about this contract because I didn't see it. I mean, I got it right here.
Give us a second. Thank you. I'm so quick. Thank you. While we're waiting, just a reminder to everybody, and thank you so much for Amy. Our next meeting is November 18th. We had to change the date because of the we don't have the virtual capabilities on our regular scheduled meeting. Right, same time, same Batman station, but November 18th.
So
Be sure you change your calendar.
if we want to table, is it H?
Yeah.
And that way we can go back to and look at 3, and I think is it 6 also?
So is there a motion?
So this is a program for all of the McLean County employees. So we have a staff member who is on so they're a county employee, and they take care of employee benefits for all of the county employees. And so that's what this program would be for. It's a database for that, for tracking. But if we want to table this so that we can check into 3 and 6.
I recommend we table it till next month.
Except, and I'm okay with that, except is it something that is important, that it gets started for the sake of the employees? So by delaying it a month, is that something that we are actually not, we're taking away the opportunity for our employees to start something that would be helpful?
I do believe she was looking to start a challenge this month and utilize this database. But again, if we want to table this and get the answers to your questions first.
Yeah, because it says only 200 employees, and if it's countywide, that's really a very few amount of employees out of 800 and something. So I guess.
If you read it though, it said they're going for 35% participation or more. So maybe they just took the third. Maybe they're just looking at that because they're saying the more that participate, the better the more effective it is. And so they say they kind of need a minimum of at least 35%. So maybe that's why they set the number lower. I'm surmising.
I think that's pricing information, and I had a question about that too, Susan. So yeah, I mean, I understand. I don't know. I'm just uncomfortable with handing over that information to a third party. If we've got an employee who could, if they need to know things about individuals to target them for challenges, and I think we could provide them the names of those individuals based on our records. I'm just a little uncomfortable with handing it over to them. And the issue is in 8, Jessica. So it's 3 because they'll do it, and 8 is the information assets and non-disclosure.
Judy, go ahead.
Is this similar to the EAPs that many employers offer? Is it intended to serve somewhat of that function?
This is an opt-in program, so it would just be available to county employees that wanted to. But it's, again, the challenge that we were looking to use is a step challenge. So being able to track different wellness activities that employees are doing.
And is this the first time for the county to use this vendor in this program?
Yes, and it may be the first time that it's gone through the health department.
Okay. Yep, I think we may need to get some questions answered.
Okay.
Yeah, I mean, I think they could have their county email address certainly, but I don't know why their birth date is necessary to give to them. And, even with EAP contracts, that information is not given out.
Maybe just their year of birth or their age.
No, it's private information. I think that, that's something.
No, I think we're at a wellness program, you need to know the person's age and their gender so that you could set up goals. I'm not saying not table, I'm just saying that might be what we look at changing the contract to.
I would be opposed to anything that would give wholesale data over to a third party like that.
Okay.
On those private issues, email address, fine. They're also talking about texting, which would be private phone numbers.
Okay, Susan?
In the past, I recall, and I think several of you might recall too, and when they had this wellness program, they would always give a presentation to the Board of Health, and they always gave it to the Health Committee too, as to what that wellness program was for all the employees. So I know that things are different this year, but I think that maybe that would be appropriate too, since we're going to table this, to have that presentation to give us more information that way, and have that person who's in charge of that give us more information. at our next meeting.
So
do we have a motion on the floor to, I'm sorry.
no, go ahead,
Go ahead.
Judy.
We
Could I-
have a
could I
motion
ask
on the floor
Yes, we have a
I'd
motion
like
on the floor to
that
table.
we table this. Uh-huh.
That is the motion.
Actually, it was the approval. We need a tabling motion.
I thought we had a table motion. Okay, so I need a motion to table item, I thought we already had one. I'm sorry. I need a motion to table item H. Judy
Two, move.
and Sonia.
A second.
And that's an excellent idea, Susan, to have them come and give us a presentation. I did not realize that we had done this in the past.
May I ask if staff are anticipating something happening? Have staff already been told something was going to happen? I just don't want to contribute to, if this is about well-being, I don't want to contribute to looking like we're not supporting well-being. So I just think we need to make sure that people understand why we're tabling it. You know what I'm saying? So that staff understand that we're not trying to be not helpful to them.
We're gonna go forward with the challenge.
Good point.
Yeah, we're gonna move forward with the activities. It's just gonna look a little bit different in tracking. So, the activities are still planned.
Good.
Good,
Thank
because
you.
I don't want to interfere. I don't want to look like we're trying to not support this. Thank you.
No, we're just trying to support their privacy. So we're voting on the motion to table.
Carla Cole,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Yes.
Susan Schaefer.
Yes.
All right, motion carries. We'll table that to our next meeting, November 18th. Be sure you change your calendars. Otherwise, we won't be here. So don't forget to take a selfie of yourself in your mask. Send it to Amy Brooks so we could. You guys did a good job. It was an excellent idea, Hannah. Some people let their little children out and they did an excellent job.
You want us in the real mask or in our fun mask?
Your fun masks,
Okay.
ones that you had on. You have multiple masks? Of course you do.
Well, of course I do. But this is inside my fun mask. So, yeah.
Okay, well, that's just the outside part of your fun mask is good,
Okay.
okay?
As long as you know I've got a liner in it.
Safety first. Thank you.
Exactly.
Thank you, everybody. Have a good week. Stay safe.
Good night.